Hello and welcome. It's 10:50 a.m. here in Seoul. I'm Lee Kyung-eun at Arirang News Center. We're breaking into our regular session to bring you a live briefing from the South Korean health authorities on the COVID-19 outbreak. In just a few moments, we'll cut into the briefing at the Seoul government complex with simultaneous interpretation in English. We'll cut into the briefing now.
And today we are joined by Mr. Yang Dong-gyu. And we also have Yoo Joo-hun, Yoo Hak-seok from the Foreign Ministry, and Mr. Kim Sang-bong from the Ministry of Food and Drug Safety, and also Lee Sun-gun as well. And we have Lee Seung-eun from the Vaccine Department, and we also have other officials from the Pan-Government Vaccine Development Department, and we also have sign language translation available for you today. First of all, here is Mr. Son Young-lee with the briefing explanation. Let us now begin our regular briefing for December 18th, Friday. As of today midnight, we have a total of 1,036 new local infections, and among them, 757 have been reported in the metropolitan area, while 279 were reported in the non-metropolitan area. And we had 11 additional fatalities. I extend my deepest condolences to the deceased and the members of the bereaved families. The government is carrying out more extensive testings, and we are aimed at testing and identifying the patients at an early pace. And we are also extending the hours of operations for the screening clinics, and we are carrying out the testings for people without symptoms as well. And also starting from the 14th, we have set up a total of 122 screening facilities, makeshift screening facilities at the metropolitan area. And we are also carrying out, on top of our PCR testings, we are also carrying out swift antigen testings as well as saliva-based testings. And we have yesterday carried out 32,000 cases testings at these centers, and a total of 70,000 have been carried out so far. And yesterday alone, we have carried out about 80,000 cases alone. And compared to October, this is more than 10-folds of our testing capacity. And through this, we believe that we can identify the patients at an early stage, and we are containing the virus, exerting our full efforts to contain the virus as well. So we ask you to get tested if you have any suspicious symptoms. And the government is also witnessing 1,000 daily cases of the COVID-19 on a daily basis, and this is why we are also exerting our full efforts to secure more hospital beds. And during the next 20 days, we will secure about 10,000 additional hospital beds. And we also will ensure that we have more hospital beds for the live treatment facilities. And we have secured 3,300 beds for the designated hospitals, and also 50 for the critically ill patients. And currently in the metropolitan area, we are seeing, as for the utility rate of our hospitals, we are seeing many hospitals in the metropolitan area taking up a high percentage of the operations. And in the metropolitan area, we are also seeing that we could house more live treatment centers, and this will also increase going forward. And as for the critically ill patients, we have 45 beds in the non-metropolitan area and 4 hospital beds in the metropolitan area. However, we have secured 20 more hospital beds at the Seoul National University, and 9 hospitals at Bundang Hospital as well, and Gangwon University as well, 6 additional hospital beds. And going forward, we will be securing more critically ill patients' beds going forward. And also, we will be making sure that we have COVID-19 designated hospitals for the critically ill patients, as well as for those who have severe symptoms as well, and these are also commencing as well. And starting from the 12th on the December, we will be opening more hospitals, especially 4 specific hospitals, starting from 17th to treat the COVID-19 patients. And we will secure more than 2,000 hospital beds for these patients with severe or critical conditions. And going forward, we will cooperate with the medical circles to secure more designated hospitals. And we have seen that more than 800 cases have been admitted to the hospitals or the life treatment centers in the metropolitan area. And we have about 400 of them who have been waiting for about 1 day to get admitted to the hospitals. And we will also exert our full efforts to secure more hospital beds going forward. And we are also having opening up new 2 of the life treatment centers with 700 rooms available, and they will be opened during the weekend. And we will also be able to admit more people and more confirmed cases to these life treatment centers. And at these treatment centers, we will have people who have light symptoms like fever, or those have other underlying illnesses that make it difficult for them to go into the other ordinary life treatment centers. And in the metropolitan area, we also have the joint response room, and we will designate more experts and medical circles so that we have less gray area in these areas. And as for these special patients who need special care, like the pregnant women, we will also have tailored treatment and care going forward. And as for the people who will be switched from the designated hospitals to life treatment centers, we will have more of them going forward, and we ask for your participation going forward. And we are also mobilizing more medical staff in these areas as well. And we have also dispatched and mobilized more public medical staff, and we are also exerting our full efforts to secure more private medical staff. And about 1,000 people have been volunteered in among those the medical associations, and we are also cooperating so that we can switch some of the guidelines. And as for the 4th grade year of the medical school students, we will make sure that they are mobilized at the at these testing centers so that they can also volunteer there as well. And as for the nurses nationwide, we have a total of 2,400 additional nurses who have volunteered to help out to treat COVID-19. And as for the COVID-19 treatment, we will be providing more incentives for the nurses, and we will provide more equipment so that we can enhance the environment of working at these critically ill patients ICU units. And at this very important juncture, we would like to extend our deepest gratitude to all of the medical staff for your participation going forward. Right now, the most important aspect of the COVID-19 quarantine measure is that we need to reduce social contact and wear your face mask at all times. Right now, rather than enjoying your social activities, it is very important to keep social distancing and not taking off your mask at any time. And at the metropolitan area, we have higher risks of COVID-19 infections, and this is why we need to take particular precautions. We believe that the government's quarantine measures alone will not be able for us to contain the virus fully. Even though we have to elevate our social distancing level to level 3, if we do not have participation by the public, we believe that we cannot contain the virus, and we are restricting the operation to close after 9 p.m. And we have these measures because we are discouraging people to utilize these facilities during the daytime as well. And we are also seeing many people who are not having their masks while eating or while working out and so forth. So please take particular precautions, and please avoid going to the environment where you have to take off your face masks, or you need to also minimize your social contacts. testings. And please take into consideration and please abide by these measures as well. Last but not least, among the nursing hospitals and care centers for the senior citizens, we ask for your particular precautions as well. For all of the staff members who are working at these facilities, they need to take particular precautions, and we are subjecting everyone to carry out the testings, and we are carrying out regular testings per every week or 2 weeks for the PCR testings at these facilities as well. And we will be commencing our on-site inspection and monitoring so that we have no rooms that are left behind for quarantine. And please also comply with these measures, and we give you our appreciation in advance. However, at numerous facilities, we have seen cluster infections breaking out, and most of these cluster infections stemmed from the faculty people did not wear their face mask, or also they were dining together at a joint facility, and also they were engaging in dialogue, and these were the major causes of virus spread. So we ask you to also take particular precautions. Please wear your face mask at all times, and please supervise the caregivers to wear face masks as well. And if you feel sick, please get tested as soon as possible. Aside from these regular testings, if you feel suspicious, we need to also encourage testings, and we will be dispatching swift antigen test kits and to these nursing hospitals. So if you have any suspicious, if you feel suspicious of having COVID-19, please get tested as soon as possible. And while you are going to or going from out of work, please get your temperature screened, and so that we can make that the virus outbreak to be reduced. And as for all of the residents as well as the caregivers, we ask you to please take particular precautions, as you are the groups with the virus vulnerable groups who are more prone to virus infections. And the government will exert its full efforts to recover our quarantine network and to also recover our medical capacity going forward. And we ask the residents and the public to consider and to take part in the quarantine measures, and also minimize social contact and social gatherings. This is also advised for everyone throughout the nation. And during the February and March period, we have seen major two crises of our COVID-19 outbreak, and they have fully cooperated and participated, and we have been also being able to contain the virus previously. And if we also muster our strength going forward together with the government, we believe that our public have the potential to overcome the third wave. Thank you very much. And next but not least, we also have Mr. Lee Min-taek, who will be providing us information about the vaccine procurement. Good morning, ladies and gentlemen. I am the Secretary General of the Pan-Government Initiative to secure vaccines. And up until now, the government has exerted its full efforts to procure COVID-19 vaccines, and we will be reporting to you the progress of these vaccine procurement as a representative of the Korean government. And going forward, we will also disclose the information on how we will be vaccinating the public, and these will be provided to you as well by the Ministry of Health and Welfare. So I will give you detailed information. Up until now, through various media reports, we have been reporting on these measures. However, there were very many misreported aspects, so we would be willing to provide as much of information as possible. And we believe that these misinformation was also not disclosed to the public because we had confidential agreements with these companies and developers. And even at this moment, there are still many areas that we cannot reveal fully, and please understand this aspect. And however, we will provide as much information as possible. The COVID-19 vaccines, we are carrying out the vaccines. We have been carrying out these negotiations since July, and back then we did not have information on which vaccines were credible. We had the AstraZeneca, Pfizer, and Janssen Moderna vaccines, and as you know already, we have had these progress so far. And as for AstraZeneca, we also signed the agreement. We also signed the MOU and the intentions of letter of intention on the 20th of July, and also during the months of August and September, we carried out the discussions with these companies. And going forward, we also conducted about 10 rounds of discussions, and we carried pan-government joint groups discussions with these global pharmaceutical companies, and these are the progress of our negotiations. And aside from these, as you know, the COVAX facility, we have also sent our letter of intention to join the facility on the 30th of June, and we have sent the final letter on August, that is, and currently we have secured about 10 vaccines for 10 million people, which is about 20% of our national population. And as we were dealing with these vaccine development on the 29th of June, we established a TF team, and they included people not only from the Ministry of Health, but also people from the Foreign Ministry and the Ministry of Food and Drug Safety as well. And we also had the Finance Ministry joining us as well. And we dealt with the trends of the vaccine development as well as the COVAX facility, and also the necessary budgets as well. And despite these uncertainties that were mounting globally, we were able to secure enough material or data, and we reviewed all of these data. However, the TF team of the pan-government TF team, we have also receiving some reports of related deaths with the AstraZeneca, and also as for Janssen, we had some side effects as well. And as for these reports, while we were in the negotiation process, we had very many difficulties and hurdles. Nevertheless, our TF teams, we carried out the negotiations with the drug makers, and they were also reported, and they were also helpful in devising our plan of vaccination on the September 5th. And this entailed securing about 60% of population and the vaccines to vaccinate 60% of the population. And later we thought that we could vaccinate also more than 60% of the population. So this was our second phase, and this was the major guideline for our vaccine procurement. And later we carried out continued talks with the global pharmaceutical companies, and during this additional progress, we opened our ears to the experts' opinion. We established a committee of experts, and we carried out 2 rounds of committee meetings in November, and we also reached a discussion and conclusion that we need to secure vaccines that are credible, and we need to do so in a swift manner, and we need to expand our the amount of these vaccines. And this is why we carried out an ministerial meeting under the Prime Minister, and we also rolled out our detailed plans. And in the initial stage, we said that we will secure vaccinations for 60% of the population. However, after our rounds of interview sessions with the experts, we also have, because there are uncertainties of the vaccines, we can secure, there is a need to pre-order and secure in advance more doses. And under this process, which has been revealed to the public, we have secured the vaccines for 44 million people. And during the first quarter next year, we will be introducing the vaccines on a consecutive manner starting from next Q1. And with these vaccine shipments, and we believe that we will also plan to inoculate the public, and we will also provide you with these detailed plans as well. And as we told you, the vaccines for 44 million, this is the amount of vaccines which will be secured before the end of next year. So we have secured these vaccines, 10 million from COVAX facility, and also we have secured 33 million vaccines for these companies, for 33 million people. And so we have secured, as for the vaccine doses, for 10 million within the COVAX facility. As for the timing of procurement, we are having our negotiation right now, and we had the first round of negotiations, and we had 3 vaccines that have been recommended. First, AstraZeneca, and second, the Pfizer, and third, Sanofi vaccines. And as for these 3 vaccines, we have showed our intent to supply these vaccines. And as for the timing, we are continuing our discussions, and currently with COVAX, we are also cooperating so that we can have these vaccines within the first Q next year. And next week, we also aim to have a meeting with the representative of the COVAX facility, and we will also have a discussion on the timing of the vaccine supply. And also the vaccines for 33 million people through these global companies. We have been securing these vaccines through our pre-order agreement. And as we mentioned so far, we have inked the deal with AstraZeneca. And as for Janssen, as early as next week, we believe that our contract could be inked. And as for Pfizer, we are also in the final stages of a legal review of our agreement. And we believe that during the month of December, we can sign a deal with 2 additional pharmaceutical companies. And as for the Moderna, we are aiming to sign a deal on January next year. And as for the amount, as mentioned so far, AstraZeneca, we have 20 million doses, and we have also signed so that we can have the vaccines before the first Q, February or March, and we will be carrying out these inoculation program in.
That was the government briefing on the COVID-19 situation here in South Korea. It confirmed 1,062 cases on Friday. That marks the 3rd consecutive day there has been a 4-digit increase in cases. All but 26 were locally transmitted. Seoul alone had 398 new cases. This brings the nation's total cases to more than 47,000. That's all we have for now, but we will have more updates on the vaccine. We'll be back at 12 p.m. Korea time with our midday news with Mark Broom. Bye for now.